Dr. Salcedo, it's nice to meet you.
My hands are cold.
Oh, it's okay. I know you've been holding ice packs. All right. So, tell me, what are you interested in today?
Usually Dr. Alessi puts in Juvederm or Sculptor or whatever, but this time it's the Restylane, I think.
Okay.
Just to raise the cheekbones.
All right.
And usually he uses, it seems my body takes 2 vials.
2 vials of the Restylane. Okay.
Yeah.
The Restylane Lift, correct?
I guess so.
Yeah,
You
okay.
know more than I do.
All right, yeah.
Okay.
Have you tried Voluma yet? Juvederm Voluma?
Yes, that also works well too. It lasts longer, but it's more expensive.
It does, but it lasts longer is the key.
True.
You can typically get a year out of Voluma.
Okay.
How long have you noticed when you get Restylane Lift? How long does it last for?
About a year. It's been pretty good.
Oh, okay. That's not bad.
Yeah.
Okay, so we could go either way with
Okay.
it, whatever you prefer. I personally use Voluma more.
Okay.
I think it does last a little bit longer, and I think I get good lift out of the cheeks.
More so than the other?
I feel like I do.
You've noticed.
Yeah, I mean, it's essentially, it's a very similar product. It's
Yeah.
just I have a lot more experience with using Voluma.
All right, I'll use your...
Okay, you want to go for it?
All right.
All right, I think you'll like it.
You promise it lasts longer?
I think it does, yeah. If it doesn't, yeah, you can hold me to it, exactly. If it doesn't, you let me know, and then you just go back to the lift, the Restylane Lift. But
Okay.
I think you will notice it does,
Okay.
and I think you'll be happy with it. Okay?
The dramatic look is good at this point of my speech.
Oh, it is?
Yes,
Okay,
yes.
so that's what we're going for, huh?
Something dramatic, a little dramatic.
Because I noticed you still have a lot of volume in your cheeks right now.
Yeah, but
You
it
do?
looked great last year. I mean, it looks more chiseled, because as all this falls,
Yeah.
you gotta do something.
Oh, yeah. Oh, where would you want it? Let me grab some gloves. Okay, so tell me where you think you've lost some of the volume.
And there, it used to be much higher.
Okay.
Up in here.
What about in here, centrally? What do you think about that?
I just don't want to look puffy. I mean, a lot of women that have stuff put in, they start looking bulldoggy.
They can, yeah. That's definitely something we have to be careful with, but that's why we do it conservative.
Okay.
You know.
So if you put it there, though, why do you use... Will it get rid of... I think they're called malar bags.
Malar bags, yeah.
I was trying to get rid of those damn things.
Yeah. I have noticed when I do my injections of the Voluma, I put them close to the rim, okay, the orbital rim, and that does improve that just a little bit, the tear trough area and those malar bags, just slightly.
It's hereditary. My father had them. I've done everything to get rid of. So if you can do that, that'd be great.
Yeah. For
Try
sure.
it. Okay. I really look like my mother than my father. So.
Now, how sensitive are you to pain?
Not overly.
Okay.
Yeah, I put all that stuff on.
But with that, do you find that it's still relatively painful, or
It's doable.
is it doable? Okay.
It's doable.
Because I can do something that I personally like to do it. I think that it helps a lot with the injections. What I do is I just do a block. I put a little 1 cc of numbing medication on each side, and you don't feel a thing.
All right.
So you're gonna love me for this.
All right.
And you're not gonna want to go back after you
Okay.
have this
I
done.
trust you.
Okay.
So what did you train under mostly for your...
Plastic and reconstructive surgery. So aesthetic as well as reconstructive. So we did everything from dog bites to people's face, amputations of the hands, major mangled extremities, anything you can think of we did. It was a level 1 trauma center. So
I mean, what happens to some of these women that Dr. Alessi fixes is just extraordinary.
yeah.
He said he was working on the gentleman that had acid thrown in his face in England.
Yeah. Yeah, that was a pretty interesting case. Now, have you had something injected here? It looks like you have a little bruise there.
I don't know why, not lately.
Okay.
Yeah, I just noticed that too.
You may feel a little poke,
Yeah.
okay, and then a small burn, but then
Okay.
it should go numb. All right, so go ahead and
So
relax.
here are your 2 balloons.
I like you keeping your eyes closed. That's perfect. Okay. Feel a poke. Yeah. Here comes a little burn. I guarantee this will be worth it.
Okay.
So this is an infraorbital nerve block. And this will numb the area of the cheeks on both sides.
That was not bad at all.
Excellent. Sure. So it gets around all those tissues.
Okay.
and it doesn't create volume. So when I inject it, I also want to spread it out so it doesn't fill.
Okay, got it.
I don't want it to mask the areas of depression that you have, so we know exactly where we're filling. And you'll know when it starts kicking in, because this will all start going numb. I mean, you already had numbing cream here, so you may not feel it here. But once you tell me your upper lip is starting to go numb, then I know it's kicking in.
Oh, okay. Well, it really spreads around then, doesn't it? Yeah, it's definitely going numb.
So when it comes to numbing, the topical anesthetic helps a lot with the skin and this area for the initial poke. But when I inject the Voluma, I go deep. I'm basically pre-periosteal, which means right above the bone. Okay,
right,
so that it's a deep injection and pushes your tissues out. That would still hurt. The topical numbing medication won't get down that deep. When I do this injection, it blocks the nerve that provides sensation to your cheeks and your upper lip. That's why you feel your upper lip going numb. So now when I do those deep injections, you won't feel them.
Okay.
The topical wouldn't have taken care of that, but now this nerve block will.
All right.
So you should be comfortable through the whole procedure.
Because when I've just had the topical, it has, it's not horrible, but it is a beast, a heavy bee sting.
Absolutely.
Several times.
So this will help with that. So here's an important point about needle selection. The needles that come with Voluma are these short needles. They're basically half-inch needles. I don't believe that's adequate to get into the deeper tissue. So I use a 1.5-inch needle, which is a much longer needle. It's still the same size needle, but it's much longer. And what that allows me to do is to get into that pre-periosteal layer, like I was talking about, into the deep tissues, and really get a true deep lift from these injections.
Now these needles are a little thicker, or the solution is
Same.
thicker than the rest of it, I thought he said.
Yeah. Yes, there's a higher G prime for this filler, and what that means is so the Voluma is a thicker gel, a more cohesive gel, and that's what causes more of the lift. The Velour, the Volbella are thinner gels, and they're a little bit more runny, if you will. So this one stays in place, it stays firm, and it lifts the tissues out.
All right, makes sense.
Let's sum up again what our goals are here. With the mirror, just so we're both clear, you want more definition here.
Yes, and as high as you can go, ideally.
As high as we can go,
Yeah.
okay. So a lot of this high arch cheekbone look. But honestly, I think you do need a little in here as well.
I trust you,
just
whatever.
a little
Yeah,
bit there
okay.
to add some volume and give a little roundness to this front area of the cheek.
Which would get rid of the
malar bags.
malar bags.
Well, it will help.
Okay.
It'll help, I think.
Yeah, nothing gets rid of them, I know.
Yeah, and you really don't, take a look right now. I don't even really notice. I mean, I noticed this one a little bit, but not a lot.
Okay.
It's really not bad.
They were worse before I came to Dr. Alessi.
That is
About
awesome.
a year and a half, I think, yeah. A year, a good year.
Okay, well that's lasting quite a while for you. That's actually great. Okay, so let's start. And you tell me if you feel anything.
Okay.
So I'm going to start the injections in the malar area. Over the malar bone. So I'm going to do a little bit centrally here to help with that. You wouldn't feel it anyways.
Okay.
You're numb. So I'm just forming the gel and trying to keep it where I want it and give a nice shape to the cheeks here. Oh yeah. Okay. Take a look. Okay, here comes the poke. Put a little bit in here centrally. Relax. Yeah, there you go. Are you feeling it a little bit out there?
Very little.
Okay. So these are still deep injections. So after I inject, I always mold and try to make sure that I'm putting the filler exactly where I want it. So it's like a free facial, free face massage afterwards. Okay, let's take a look. You take a look now, and you tell me. I'm seeing one thing, and I want to see if you see it as well. Just a little difference. Go ahead.
Well, I see more definition here than on this side.
Okay.
And I don't know why. Maybe it's just me.
Might be the way I molded it, but I can.
Which I like more definition on my left side.
Okay. Then I can add some more here, but also what I was noticing, take a look, is I still think I need to put a little more in here. This one seems a little more full than the outside. It's very close.
Meaning, I don't want puffy cheeks. Oh,
Okay.
you're saying it's...
You know what? In that case, then
Yeah.
let's leave it how it is.
Okay.
Okay, because I think they're pretty close. You already have, if you smile, you can see you have a lot of fullness in the cheeks already.
Yeah, that's more than enough.
So then let's match this side to that
Okay,
side.
yeah.
If this is what you're liking, that's kind of what you're going for.
Yeah, the upper
Yeah,
up in here.
then let's add some more here.
Okay.
So let's do it. But let's not go too far. We gotta make this even.
Yep. Great.
I agree. Okay, let's get some afters. I think you're gonna like that. I think we put it exactly where you wanted it. That's why
It does, yeah. It looks
as
good.
as I'm doing these fillers, I always want to have you take a look and tell me what you're seeing versus what I'm seeing and where we can meet in the middle and make sure that you get the look that you're going for. So, and I think we did that.
I think you did too. Yeah. And how long will it take for the numbing solution to wear off?
So that'll last for about 2 hours.
All right, it's not too
Yeah.
bad.
Technically 90 minutes,
Okay.
but I tell people it's going to be closer to 2 hours, so
Okay.
don't do anything super chewy. Okay, you might be chewing on your upper lip and not even know it.
Okay,
So
lovely.
yeah, so just be careful with that.
Okay.
But other than that, don't put pressure on this area. Okay,
Great.
let things set up, and you're fine to wear makeup tomorrow.
Okay, great.
Okay,
Mhm.
all right.
Thank
No
you so
major
much.
cardio today.
Trust me. Yeah. I gotta work for another 12 hours, 8 hours or so. Yeah.
Okay, perfect. All right,
Thank you.
great. Yeah, it was very
All right.
nice to meet you. Yeah, me too.
Maybe a little later you can work on the neck. Get rid of all that.
We can do it all. We're full service here. Yeah.
Okay, great.
All right.
Thank you so much.
Yeah.